Welcome, everyone. Welcome to the distinguished lecture series of Hindu Physicians International. My name is Dr. Adityanji, and I'm the president of the Hindu Physician International. I'm trying to run my PowerPoint, but it looks it's not moving. Okay. Let me try once again. So I'm not able to move my PowerPoint, but I will briefly introduce what is HPI. HPI is a dharmic faith-based initiative by physicians, and it is basically to do community service, humanitarian assistance, and possibly disaster relief. As we grow, we will be also looking into working on environmental preservation. Our mantra is Sharira Madhyam Khalu Dharma Sadhanam, which basically means that body is the temple, both from the perspective of our patients, but also for the physicians, because if physicians do not take care of their own health, they are likely not to be able to assist the patients or help the patients deal with their illnesses. So we have a structure in which we have a board of directors. We also have an international advisory board, which involves a number of physicians, and we have an executive committee. And at this point in time, we are looking at people who are willing to work on our executive committee, young physicians who can work with us in a selfless manner, in a charitable institution. So, the lecture today is by Professor Narasimha Pinenti. Professor Pinenti is professor of psychiatry in New Jersey, and he has written or co-authored more than 4 books, more than 50 research papers. He teaches not only in United States, but also in 8 different universities to post-residency programs on cognitive behavior therapy. So without further ado, it is my honor and privilege to introduce Professor Narasimha Pinenti. Narasimhaji, please take the podium and you can start with your presentation.
Thank you very much, Adityan. Are you able to hear me clearly?
Yes, I am able to hear you clearly.
Okay, that is very good. And now I'm also going to test if my sharing works. Okay, and okay, are you able to see my slides?
I'm having some technical difficulties, so
Yes, we can.
Yes,
You
we
can.
can
Yes,
see the
okay.
slides.
So
We
I'm
can
going
see.
to move it to this. Okay. So Adityanji is a good friend of mine, and I thank Adityanji for giving me this opportunity to share my experiences. And that's exactly what this talk is going to be. You're not going to find that I am quoting randomized control trials. I'm putting scientific information up in front. However, this is something which comes out of my own experience of over being in psychiatry for over 3 decades. Okay. Um, uh, my slide show is working. Adityan's did not work, but I'm able to go to the next slide, which is good. So what I would like this to be is not just that I'm talking about a few things and then you are hearing about them, and after the lecture is done, then this is business as usual. I would like you to really reflect on what I'm talking about and and see if any of the ideas that I'm talking about resonate with you. And if they resonate with you, I would like you to kind of share both in the chat. And I hope that we are able to have enough time to be able to discuss these issues. So let me first start off by saying why I use the word healing, when healing is normally a word which is used in circles other than medical circles, even though we talk about our treatments heal people. But there is a reason why I talked about healing, because I think that is something that an aspect of our treatment that we are not paying as much attention to. And the next slide is going to show a little bit in terms of what treatment and how treatment and healing differ a little bit. Okay. So this is not comprehensive, but basically we are very familiar with the treatment, right? Treatment is about people come with symptoms which cause them distress and dysfunction. And what we are doing is that we are diagnosing, we are trying to alleviate the symptoms by we go from the symptom to the syndrome to the disease and then treat the disease. And our treatment is evidence-based. It is some protocol driven. And then we constantly improve upon that process. And most of the interventions are kind of that are provided to the patient. We are the experts here. However, what is then healing? So the healing is a process by which an individual who is suffering from an illness have impact at not only the physical but the psychological and the level of their spirit. And this healing is attending to these aspects and helping them to kind of address this in an effective manner so that the individual is restored to who they are before whatever the illness started. So it is about helping the individual to become their very best self before the illness actually impacted them. Now, a lot of times, the physician, what the physician does in his capacity, helps the treatment part of it. And most physicians can either be facilitators of the healing process, but very few physicians actually pay as much attention to the healing process and be healers themselves. So my challenge here is for why should we also not be healers while we are treating individuals? And for us to be able to do that, we have to look at what is the evidence saying about about healing and where the role of the physician comes into healing. So I would like you all to just reflect on these questions here. Where do you fall in your practice? Category 1, You treat your patient. So you do your job, you are going according to what your guidelines are, and that's who you are. And if there are issues beyond that, then we have other specialists to take care of, or other professionals to take care of. Category two, I treat the patient, but I also connect with the person who is having that illness or disease, so that I not only have the relationship of treating, but I also know who this person is. That is slightly a higher level of involvement and caring for the individual. Uh, Category three, I treat the patient, but I also facilitate the healing in the person who is distressed and who is in front of me. So essentially, you are expanding, or at least you are saying to yourself, my role is to take away the distress of this individual wherever the distress is coming from. It does not mean that you are actually doing it. It only means that you are looking at it, you are addressing it, and you are saying that I am also responsible for this part of it. And you may say, hey, for this, you go here. For this, you may have to do that. But you are keeping that in your consciousness and you are addressing that. Now, with the specialization and further specialization in medicine, that is becoming a little bit more difficult because in a previous lecture from HPI, where there was a talk about Ayurveda. We talked about how Ayurveda is more about integrated the whole person, while allopathic medicine is more about specialization. Okay, so this kind of ties in with what we heard in that lecture. Okay, so then the next question is, why did I choose this topic? Okay, this is because number one, two things. There is a very high degree of stress and burnout in physicians. And the studies say variously it is 40%, 50%, 60%, does not matter. If there is stress for a significant number of physicians, the question is why? Okay, if we really ask every physician who is in this field and say, hey, did you really want to be in medicine? The absolute answer is yes. That's why I spent 4 years of medical school. I spent 4 years of residency. And of course, I did a second residency, and people like me did a third residency. I started in India, then I went to England, and then I came to United States, and we had to do three times because this is what we wanted to be. Okay, then the next question is, are you able to be in the specialty of your choice, and are you able to practice medicine? The answer is yes. Then the question is, why are you unhappy? What is stressing you out? Okay, so that is a question with, of course, we all say it is because of the system or whatever it is, but there is a stress where there should not be, or there should be very minimal stress. Okay. The second reason why I wanted to talk about this is that I enjoy my psychiatric practice. A month ago, I think, when Adityan called me and said, hey, by the way, Narasimha, how are things going with you? I want you to give a talk. And we had the conversation about, hey, are you cutting back on your hours? Are you thinking about retirement? And my answer to Adityan was, listen, Adityan, actually, several years ago, I thought that around this time I'm going to retire because I have been in psychiatric for a long period of time. But do you know what? Every day when I'm getting up, I'm actually looking forward to going to work. I go to work, I am working, I'm having fun working, and working is like a walk in the park. I come out, and then I have enough energy to do the things I want to do. So I'm not even thinking about retirement. So I said, and as I think about the stress a lot of individuals are facing, I say, what is different? Is it that am I delusional here and I'm have some grandiosity and I'm feeling this way, or is it that there is something? But then as I thought about it more, it occurs to me is that there is something that I can share in terms of my own thinking and perspective that I have developed over a period of time, and that is partly what I'm going to try to do today. So now it goes without saying that a happy doctor makes a very happy patient. Okay. Um, the next couple of slides actually will show us that. Okay. So what happens if the physician is happy? Okay, the physician can be more empathic to the patient. Number one, when the physician is more empathic to the patient is able to trust the physician and open up, and they are able to more engage at a deeper level with the physician. When the patient has a good experience with the physician in terms of their interaction, guess what? Whatever the physician is telling, the patient is more likely to follow. So there is improved adherence. When the improved adherence, there is also improved follow-up. So the individual who did not take antihypertensive medication because all the doctor did was just write a script, goes to a different doctor and who kind of takes the time and explains, he feels connected to the doctor, and lo and behold, he's taking his antihypertensive medication. Oh, and then his hypertension is controlled. That is one risk factor controlled. And then what happens? Less likelihood of stroke. So patient outcomes improve. And by the way, if you look at malpractice suits, one of the common thing is that the patients are dissatisfied with the communication of the physician, with the connection with the physician. Lot of times when patients are satisfied, they let things go. So a happy physician not only leads to better outcomes for the individual, less lawsuits for the organization that they are working in and for them individually, and are a more satisfied, he or she is a more satisfied person. So this, when you look at this, all says, then everyone should be looking to make sure that a physician is very happy in what they are doing. So um, uh, what I'm going to do is that I actually used a Slido, and I'm going to share this particular, hold on, let me, I want to do a survey here, online survey while we are talking, see if I am able to get your input. How many of you actually do focus on your joy and satisfaction in practice? So this is what I want to do. See, I don't know if I'm able to. No. So no, I'm not able to do it. So we'll move on. So this is a question for you. If you can just say in the chat, yes, no. How many employers actually, and also a question for you, how many of your employees actually are focused on physician satisfaction, fulfillment, and joy? Really focused on, okay? And so my answer to these questions, most physicians are not thinking about their joy and satisfaction. They're thinking about overall, hey, I have to complete my job and all. Your organization, your employer is not looking. Of course, will your patients be? No, your patients want you to be to do them the very best. But they know, they say that the doctors are paid very well. They are good. They have to take care of business, and so they're not thinking about your joy. So then who should be doing that? Okay, so if we really want what is best for our patients, if you want what is best for your families, if you want what is best for yourself, you have to take this into your own hands. You have to do it yourself. Okay, then so if your joy in your work is your responsibility, then you might say it is very easy said than done, and you are absolutely correct. It is very easy said than done because there are multiple barriers to that. So the barriers whenever there are barriers to anything relating to medicine, I look at barriers in three different groups. Barriers from the individual physician, barriers from the system, barriers from the patients that who would be treated. So then the next couple of slides are going to just talk about them. Okay. So when we look at the barriers, one thing which I find helpful is to look at where I have control and where I don't have control. So this is a little bit busy slide, but if you look at in the middle, this is about the control. There are certain things where we have the most control. There are some things in the middle we have some control, and the least control is here. So my personal experience is where I can exercise the most control. Next, how I'm viewing things and how I frame things is where I have some control. Okay, the systems I am part of, I have the least amount of control. Okay. However, I can have some influence, but I have least amount of control. The reason we want to be very clear about where we have the most control is that is where we want to spend most of our time and energy in. Okay? And there are different interventions for each of these, but we will talk about them. Okay. So if any of you at the end of this talk are motivated to feel that, hey, listen, I'm going to pay attention to this and I'm going to take some steps. There are the next few slides are going to talk about what are some of the things that you can do. Okay. If you have not already done. So I'm not going to presume that you have not done this. Therefore, so I'm only sharing my personal experience, as I said. So the steps are value clarification and a personal philosophy of care, your expectations and setting realistic expectations, and your strategies for issues and problems that are barriers in your joyful practice. So question number one is, do you have a personal philosophy of care? Okay. And have you written it down somewhere? I developed one in the context of I was working for Rowan University, and as an employee of Rowan, what they did is made me the director of a place called Oaks Integrated Care. So as a medical director of that place, I was overseeing the psychiatric services there. Now, I had to work weekends in a Jefferson Hospital system, which had contract with our university. Now, each different place talked about their values, talked about their philosophy of care, and I see that when I am following a patient through these different systems, they are not interested in what is best for the patient. They are interested in what is best for their organization or the individual system. And I said, listen, I did not come into this field to be an agent of a system. Yes, the system is important. The system is necessary for me to do my work. However, I am here for a patient. So I thought about my own personal philosophy, and this is what I have written down. Okay. Well, so my personal philosophy goes with 3 C's, and there is a 4th C if you have an administrative role. Number one, first C is compassionate or caring attitude. That means I am going to treat every patient as I would treat a family member or a friend. Okay. So second thing, clinical excellence. I am going to stay current and provide the best interventions possible. And I'm not going to compete with other people. I'm only going to compete with, am I doing the very best I can? And am I getting better in doing that? Okay. Number 3 is any decisions that I am making are going to be made not as an expert, but considering that there are two people here in this room who are working together. The patient is expert in their life, their circumstances, what is best for them. I am the expert in the medical field, and the two experts get together to decide on the best course of action. And my job is to educate the patients on the various options available. Okay, and help them to make the best decisions for themselves. And of course, because I was playing a role of an administrator, I had administrative responsibility. I have to be cost conscious about my interventions and my decisions, because we don't have endless amount of money, as you all know. Okay, so you might be asking, no, I can, I know what my values are and what it is not. Why do you even need to have a philosophy of care, and what does it do? And I'm going to tell you what it did for me. It is like a compass, and it guides us in making value-based decisions, not contingency-based decisions. Number one. Okay. Second thing, it helps us to separate who we are as individual physicians who came into this field for a particular reason, and separate this from what the values of the system that you are working in. And three, when system practices are not in sync with our individual values, it helps us make decisions which are true to our values and help in long-term satisfaction. The alternate is that you bend your own values to what the system needs are, and you would be keeping the system happy, but you would be unhappy within, and that could contribute to the stress level. And finally, if we are true to our values, it helps us to be accountable for ourselves. So the number one thing is the values. Second thing is expectations. So the one of the barriers in terms of a joyful practice is having expectations that are not reasonable. No, not realistic, not reasonable. There is a difference between realistic and reasonable. Your expectations may be very reasonable, but may not be realistic to the circumstances. Okay. If you really look at the number of times we get frustrated because we have a certain expectation and the expectation is not met. Okay. And that is the room for frustration. So if we set realistic expectations within ourselves, then we are less likely to get frustrated. So the number one thing, which is a realistic thing, is that no system of care is perfect. Okay. And a system of care depends on individuals. Individuals are human. The human beings make mistakes, and systems don't work. So anytime I'm going to work, I know that on any particular day, anything can go wrong. There have been days when my electronic clinical record did not work for 2 hours. There are days when the front desk did not call the people for appointment. They did not send me the virtual link. So things can go wrong. And the only time I go with the mantra that fool me once, shame on you. Fool me twice, shame on me. If there is something that I am experiencing today that I have already experienced, then I'm not going to react the way I reacted before. I'm going to this is what is expected. Okay. So that is number one thing, and it has removed a lot of the minor frustrations that I used to have. Okay, and then I know I take the position that if this happened last week, I came, I had 3 in-person visits, 4 virtual visits. I saw 2 in person, and then the virtual I was waiting, and nobody came onto the thing, onto to the link that I have. Then it follows that the person who was supposed to send the link did not. Then I immediately realized that this person may not be there. So I just found out that the person was off sick, and they were supposed to inform me. They did not inform me. So the next 3 I had to do, I just sent them the link so that they are ready and I am ready. So we have to recognize that people, our teams, are not going to be perfect. Everyone can make mistakes. And at the end of the day, if it is my responsibility to give the best experience of care for the patient, I have to be responsible for the entire team and do what I can within my control to help the patient get the best experience. Once I kind of made that kind of once I made that acceptance in my mind about the imperfections in the system, then I became a lot more peaceful. Now, accepting does not mean that I do not address that at all. Okay? There have been instances where people did not do what they are supposed to do. I take care of what I need to. However, immediately I send in a note to their supervisor and also to them with a copy to them. Hey, this is what you have missed. Can you be careful next time? So we are continuously working to improve the system, while at the same time we are maintaining a sense of balance within, so that our joy of medical practice is not stolen away from us. Okay. One more expectation in terms of never expect things to change in immediately or in the next week or next month. Take a long view. Things are not going to work on our timeline. There are things. I will give the example of before pandemic. I made a suggestion that people who are very difficult psychiatric patients who don't come into the office, a case manager who visits them. Why doesn't a case manager take a laptop, go there, and then we can connect on Teams and I can do the evaluation on the patient? Okay, and then I kept on talking about it until pandemic hit, and then I didn't need to talk anything. That is exactly what they did. Okay, and now it becomes a norm. Okay, so sometimes we have to recognize that what we are giving in terms of our suggestions, it may be ahead of time. However, we have a long view, and that helps us to keep our own peace. Another expectation, very be open and honest with the patients. Okay, the number one complaint I have from my patients is that your front desk staff, they do not follow through on what you tell them. They are rude. They are this. Okay, and I acknowledge where there are issues. I say that we are working on the front desk, and I validate their feelings. And wherever I can be honest without kind of throwing someone under the bus, I do that. And there, at least the patient knows that you are validating them. Now, it also goes to when I am making mistakes. It has happened several times when I am seeing someone virtually. I talk to them and I schedule an appointment, give them the date and time. But after it did not go on to my chart, because as I was talking, I think, okay, as soon as I'm done, I'm going to do put into the thing. And when patients call back, I say, hey, by the way, I made a mistake. This is my thing. And patients understand. Initially, they are frustrated, but they understand, but it deepens the relationship. It makes the relationship kind of more genuine. And this is how part of how we create a healing relationship. Okay. Next, focus on what is in my control. As the previous one of the previous slides showed, there are things which are in my control. My attitude is in my control. My expectations in my control. How much of time I'm spending with my patient is in my control. And what I'm doing when I'm spending time with my patient and is in my control. That is where it is going to be in terms of where my most energy is going to be spent. Now, knowing that doing the right thing takes time and effort, while doing the easy thing is easy but not fulfilling. So my choice is I'm not going to do something which is less fulfilling, even though it takes more time. So what it means is that sometimes I have to give my personal time to be able to do the kind of a job that I want to do and I'm satisfied with. Now, I have my own what we call as cognitive reframing. How I say I say to myself, listen, I gave an extra hour today, knowing that I'm not reimbursed, but this is my giving back to the patients so that I am doing what is best for the patients. Okay. So this actually, the strategies to address barriers is just a couple of things just add to what we have already talked. By the way, this barrier list is not complete. And I'm just giving you an overview here, and you all probably have some barriers which are very difficult to deal with. And if we have time, we can discuss about them. Okay, so if the barrier is that if it is my internal state is a barrier, okay, my strategy is that I have to take ownership and responsibility. So what I do is I practice mindfulness. I teach mindfulness. I work with my teams. If any team member is very stressed out, my immediate thing is I say, can we pause? Okay, can we sit? Let us see what is bothering you the most. So I take it that my team, it is my responsibility if there is an internal state that is disturbing what my patient is experiencing here. So stress team members, they're addressing ways to address their stress. Then one thing I find is that we do not laugh often, we do not laugh enough while we are working. And this includes laughing with your patients, laughing with your team members, and creating an environment where laughter is actually celebrated. So we have this thing with the front desk. I talked about the issue with the front desk staff, right? So I started with the front desk staff that we are going to end the day with at least 10 laughs. Okay, the shared laughs. It's not like we are laughing. Okay, so that and we start off with played a practical joke and everyone laughed about it and said that is number one. Okay, and then we count, and then at the end of the day we say how many did you do today? It is 5, 4. Okay, we can do better. So basically, what we are doing is that taking these stress out of the thinking of your team members and focusing on the fun part of the job. Okay. So one of the barriers, you are given too much to do and very short time frame to do the things. Okay. The only strategy I have here that I have addressed is advocate for myself before when someone is giving and say, I cannot do this in next week and I need time, or advocate for my patients. Sometimes it works, sometimes it doesn't, but that's the strategy. When you have challenging patients. Okay. Now, I deal with individuals with addictive disorders, and those individuals with addictive disorders can be some of the most challenging. And my strategy is to know that this is par for the course. These individuals with addictive disorders, particularly when they are in addiction, this thing is to lie, to cheat, and do whatever they can to get medication from you or get the high that they are looking for. That is par for the course. I cannot let that impact me. Okay. the monotony of of what we do. So my strategy for that is that I do my clinical work, I do my teaching, I do and some administrative work, then I do a little bit of writing and research. So I kind of spread it around, and I don't get kind of bored. Okay. So Adityan, can you tell me how much time we have so that I'm pacing myself and giving time for this?
We have at least 5 to 8 minutes more.
To talk and then discussion?
Yeah, then discussion.
Okay, so this is the philosophy part of it, in terms of what I want to share. I want to also share something that you can actually use in your practice, no matter what your practice is. Um, every patient who is coming with a symptom and a diagnosis, there is the physical component to that and the emotional component to that. If you want to be a healer as opposed to a treater or just a physician, then you have to address the emotional aspect of it. And the three common emotions are anxiety, sadness, and anger. And the most effective interventions for this are cognitive behavior therapy interventions. I'm not going to go into the detail because in view of the time. So basically, the oh, oh, okay. Basically in cognitive behavioral interventions, I thought, okay, the emotions, our cognitions power our emotions. And if we identify the cognitions that are powering our emotions, we can change those cognitions and then we can change the emotions. So if just to give an example, when I'm shoveling snow and then I have some, say, muscle ache, and if I'm thinking this is a muscle ache, then I let it go. But one time it happened 2 years ago that a week before my friend was admitted to the hospital with an MI. I had the same muscle ache, but my thought was, what if this is MI? Okay, then my emotional reaction is one of anxiety. Then what I did is that I talked to my wife. Hey, do you think it could be this? And of course, when I talk to my wife, then she gets anxious. Then it becomes more to the point where I went to the emergency room, and then ultimately they said there was nothing, and I came back after a stress test and staying there for overnight. Now, this is how our thinking can affect the emotions. And by identifying the thinking and changing the thinking, you can change the emotions. That's the basic thing about CBT. Okay. And in CBT, you don't have to be a therapist. There are very brief interventions people can do. And there are micro techniques that take 3 to 5 minutes time. And that can be very easily learned by any physician. Yeah. So let me see. Okay. So basically to just talk about the micro techniques. So if you ask your patient what is making them most anxious about their particular illness, then you would say, oh, I think if this means that I may not be able to work, this means that I cannot get better, or whatever it is. Once you have that thought, which is called as automatic thought, you have information, you have evidence to say that their automatic thought is not accurate. Then you give that information to the patient and you correct their automatic thought and saying there is no evidence to say that you are becoming an invalid because you had a stroke or because you had this. So nowadays, because of the AI, because people have information, people's emotions are now on steroids. Like they get a lot more information. There's a scary information they're coming. So the physicians are in the best role to be able to address and assuage these feelings by giving corrective information. But it takes a couple of minutes of the physician's time. Okay. Now, The next thing, actually, this is about the CBT. Adityan, I can stop here because the next thing is only about the addiction disorders. This is one slide. This was more kind of optional. We can give more time for discussion. I'll leave it to you.
Okay, we can stop here.
So
You-
I will then I will stop sharing.
yeah.
Okay. Escape, stop, sharing part. Okay, did I stop or no?
No, it's still showing. The PowerPoint is still showing.
PowerPoint. Okay, yeah, okay. I think I will stop okay, now I am stopped.
So, first of all, thank you very much indeed, Narasimha, for a very lucid presentation as to how physicians, even under current circumstances, can make their jobs more personally meaningful to themselves as well as to the patients that we are taking care of, and just transform our role from being just treaters to healers. And that is very, very important. We will start taking some questions, but before we take the questions, I have a couple of announcements. To all the people who are attending today, try to go to our website, which is www.hinduphysiciansinternational.com. We have a membership page. Please fill up your details. The membership of HPI is free. If you are interested in doing any community seva project, you can fill up the form for HPI certification. You don't lose control of your seva projects, whichever city you are in, whatever field you are in. We encourage physicians of dharmic origin to do community service. And most of you are doing actually some community service, but please do under the banner of HPI, Hindu Physicians International, so that we send a message to community that physicians with dharmic origin are also contributing to the society. So those are the two requests to you. Please take care of that. Now we go on to the question and answer session. And let me see if there are any questions in the chat room. There is one question, if you can, share the slides with everyone. Maybe what we will do that we will try to put these slides on our email list, or people can request uh, the PowerPoint through our email, which is sending a message to our email, which is hpiseva, SEWA @gmail.com. So if you send your request, we will be able to share the slide sets. And I think it'll be good for everyone. And we'll try to make sure that this presentation, the video recording of this presentation, is on our YouTube channel within a day or so. So with that, we are open to asking questions. Anybody can ask questions. Please keep it very brief. We are a small group, so anybody can,
I see one question already. How do you deal with lawsuit with bad intentions of patients made with AI? Amit is talking about. Amit, thank you for that question. So the there are going to be individuals who come with negative intentions and trying to do get something from you, the system you are. The only thing is that two things I would say. You have to address what you need to be from a legal perspective, whatever needs to be done. But the thing is that you cannot let that lawsuit get into your practice with other patients. If there is one bad apple, the other 95 or 98 people should not be impacted by your style. So basically, what I'm saying is that if you have one lawsuit, it is not going to change my practice. My practice is going to remain the same. I'm going to be true to my practice. I'm going to do everything here, but at the same time, I'm going to do whatever I need to fight the lawsuit tooth and nail. Okay? I don't know if that answers your question, Amit.
There is a second question by Dr. Shivam Dubey.
Uh-huh.
Dr.
Oh,
Shiv,
yes. How becoming a healer can help a physician themselves. Okay. Now, the so physicians, for you to be a healer, okay, you have to be in the best state of mind. So the first of all, physicians start looking at, I am responsible for my state of mind being the very best it can be, because uh, most of the time, as physicians, we are more focused on the quality of what we are delivering and how it is considered by our peers, but we are not focused on the internal part of it. What I'm saying is that your quality is impacted by how you feel internally. So internally, if you are in the best state of mind, then your interventions are the most effective. Your patient, your outcomes are better. And at the end of the day, you have more satisfaction, you have more energy level, you have more joy out of what you are doing.
so there's another question from Dr. Amit Kumar.
Yes.
AI is making everything very.
Everything very technical and easily pointing out the few loopholes in the prescription and treatment, and it's very difficult for doctor to cover all those things. Yes, absolutely. So in the AI world, we have not seen the full evolution of AI, and we have not seen how the medicine is going to be in 5 years' time. For that matter, we don't know how the world is going to be in 5 years' time. What we do know is what it is going to be tomorrow. So I know that tomorrow, Monday, I am going, I know what my schedule is for tomorrow. And I know that tomorrow, when I go in the morning, I go with the right attitude, with the right expectations, and I will deal with the entire day. At the end of the day, I just want to come feeling that I have done my very best, number one. Number two is that I am satisfied with what I have done in terms of my patient care, and whatever is thrown at me, I will deal with the day after tomorrow. If something comes, there is a lawsuit comes tomorrow, I'll deal with it. If something, but the thing is that you are right that with AI you have so many loopholes, but at the same time, I think no one can cover everything, and but we cannot sway away from who we are. I think that is our best hope, and that's our best shield. Okay, there's the next one was you said
Tushar Chauhan, there is a.
Every disease have psychology component. How a physician also deal with the psychology component and do counseling in better way in limited time is a busy practice. Absolutely, this is a brilliant question actually in terms of how do you do that. How do you do that is I told very briefly in here because even every patient of yours, even for them, you ask them a simple thing. When were you most worried about this particular thing? When were you least worried about this particular thing? And when you are least worried, why were you less worried? Oh, I was less worried because I thought about, hey, it is not that bad after all, because my mother said this, because of this. Then you can say, do you see the difference? The same illness, you are worried very much at one time, less at other time. See, your thinking increases your worry, your thinking can decrease your worry. I think working on your thinking can help you And maybe that is what we need to do. So simply showing the connection, that's all you can do. You have very limited time, that's all you can do. And I think if you want to work more on that, I can refer you to a therapist or a counselor. Then they are more receptive to going to a therapist. But what you're doing is that you are addressing that component.
So there was a question about, sharing the address, the URL for HPI, and in the chat room I did that. Also, there was a request to share an email address where people can send their queries, etc. And I also did that. So my hope is that all the physicians who attended today's session will carry forward some of the central themes of this particular presentation that Professor Narasimha Pinenti gave us leads today into their own clinical practices. Yes, our practices are very challenging, especially in the managed care mode or
Mhm.
in employment mode. You are
Yeah.
basically there's a production target, and you have, at certain you have to achieve certain production targets. So
True. Yes.
there may be limited time,
Yeah.
and it may be a little bit difficult. But I think if we start changing our own attitude, possibly we can attain optimization between the
Uh,
patient's need, the organization's directives, and
yes.
our personal satisfaction.
Right. And Adityan, I can do one thing. I'm so passionate about this, and I really love teaching and kind of addressing issues. If people want to send me scenarios and say, "Hey, this is the scenario. What can we do in this scenario?" I'm very happy to kind of respond.
I think that's a very nice gesture on your part to be able to take, follow-up actions, etc., from individual physicians. And I know that you are doing the, teaching of cognitive behavior therapy to postdoctoral fellows in India and here in US. So that would be very well appreciated. Uh, for the folks who are attending the lecture, I have given the email address where you can send your questions for further queries. I've also put the URL of our website. So please visit the website, and I will again request with folded hands. Please become a member of the Hindu Physicians International. It does not cost you anything. Membership is free for everyone. And we encourage you, besides your job, to do some seva project in the local community where you are, to try to help the mankind in a dharmic perspective. We want to send this message to the community. We have an international audience. We are not restricted to United States. We have people who are from other countries also. Since we came into this profession as a physician, and most of us are of dharmic origin, so the request is that spread the philosophy of Vasudhaiva Kutumbakam, spread the philosophy of Naraseva, Narayana Seva. I think that is going to bring you to more fulfillment instead of just doing your 9 to 5 job or whatever job you are assigned by your employer. Any more questions? If not, then
I will just say one thing. One of the things what I have found very helpful is that I have on my laptop patient materials, and the common things. I have about 50 different things. So I prepared and kept this brochure. So anytime I don't have much time, I'll just briefly talk about it and print it out and give to the patient what so they can read and they come back next time. So we start the relationship, we build it, and we kind of continue what we did the previous time.
very good, Narasimha. We are running short of times. We are, so we will not take further questions. Thank you very much indeed, Professor Narasimha Pinenti, for this wonderful lecture. We will have another lecture in 2 weeks' time, and that is actually on pollution. The title of that is Solutions to the Pollution, because some of us in other countries are working in a very polluted environment, and it's the responsibility of physicians also to help with preserving the environment. So hopefully on January 18th, we'll have a lecture on solutions to the pollution. I will encourage all of you to, spare 1 hour of your time on that Sunday morning. And as I said, we will be taking some follow-up, questions from you. Use the email address that has been given, and I will request Dr. Narasimha Penenti to address your questions later on. Thank you very much indeed, and we are ending this session now.
Okay.
Please click on stop recording.
Can you do that?
No, you are the host.
I am trying to go back there. Okay. Okay.